Hi, I'd like to share with you some of my thoughts on medication that's over the counter and how some of them can be dangerous and not in your child's best interests. You know, we have the wonderful kind of access in this country to medication still. Some of the medications has been recently restricted because of lack of import of certain medications. And over the last couple of months, I've been seeing in my practice parents that have become a little frustrated with their children at home during the lockdown and long protracted school holidays. Children having difficulty with anxiety, not sleeping well, not getting down and sorting themselves out in the evening with routines. Even parents have been having difficulty getting to sleep themselves. And chatting to several people over the last couple of weeks, it has struck me how important it is to have a good insight into the medication that is available. Medication that's available should be used really in context and often used for the right reasons and not overused or misused. And very importantly is to talk about some of the medication, in particular those that are used for sedation and sleeping. You know, when I talk to parents who have difficulty with their children sleeping, you know, it is almost a torturous experience to have a child that won't sleep. Parents blame themselves. They think about, what should I be doing? Is it my own routine that I'm doing? Is my child got an allergy? Have they got ear infections? They won't sleep. I'm sure it's the diet. Is it a dairy problem? And often sleeping problems in children is not necessarily your fault as parents. You know, children are very different. Often say to parents, you've got to have a second child to know that sometimes that you're not the problem. Parents who have a second child who has a sleeping problem, and they often think to themselves, you know, what am I doing differently? It's important to think about a routine. I think the basics in life from the age of 6 months is to have your child have a routine. When they eat and when they sleep are the fundamentals of being able to function. If you don't sleep as a parent and you're constantly up at night, it can really undermine your own mental health. So be very careful of reaching and going into a pharmacy and buying medication. And there are a couple of them in South Africa that are offered over the counter, sometimes very cheap. And they have ingredients called diphenhydramine under the trade name of Allergex, one of them. One of them is also Phenergan. And these are medications you need to be very careful of. In the United States, the FDA has actually warned that these medications, if abused, have the same sedation effect as drinking and driving. It can impair your judgment as an adult taking them. And giving them to children, it can cause them to stop breathing at night. It's associated with sudden infant death syndrome, and also have that kind of hangover effect the next day on sedation, irritability. Desperate parents often try these medicines. They use them. They're so desperate. Often things like still pain have an antihistamine in them, and they're used for sedation. Be very careful of those problems. When children with ADHD have sleeping difficulties, it's integrally related to ADHD. And remember, sleeping problems need to be dealt with in a more long-term, holistic manner, not short-term gain, where there's lots of side effects and often leads to more side effects the next day. So I often challenge parents, rather try and deal with the underlying problems rather than put a band-aid and put a patch on the problem. You know, if you have a serious lung condition like pneumonia, you don't take a cough mixture. You deal with the underlying problem. It might help the cough temporarily, but ultimately there's going to be a problem. So be very careful of over-the-counter medications that are not used specifically for their intended purposes. If they're properly prescribed under careful guidance of a doctor who understands them, then they are safer. But be very careful of young children taking antihistamines at night. Disturb sleeping pattern, disrupt sleeping pattern, and can ultimately lead to a lot of problems. You know, there are a lot of underlying reasons for sleeping problems. Often children that are anxious, have difficulty separating. They need routines, they need guidance. It's so easy necessarily to take the route of least resistance and opt for the medication option. So I hope that helps you have an insight into being able to deal with the underlying problem rather than the over-the-counter quick fix.